This video, we're going to be doing manual perturbation exercises. But we won't be doing it like this. Manual perturbation exercises or rhythmic stabilization is something we use time to time with our athletes, especially athletes that have an unstable shoulder. How we do it is a little bit different than what you just saw in the beginning of this video over there on the table. The reason is because this isn't specific to throwing, and I don't know really what this is specific to. We want to be specific as possible. So with Austin here, I'm going to have him in a lunge stance. He's going to reach. If this is my baseball player, I'm putting him right here, maximal protractive reach, as much internal rotation as they can tolerate. And then I'm going to give him, don't let me move you. I'm putting him in a position, and then I move him, where he's going to actually be in the throw. And then I provide variable perturbations in that position. And I can do truncal ones too, but you know, if my focus is on the upper extremity, I want to vary the position close to where he'll actually be in the throw. And then I want to do it with hamstring flexibility. So straighten that front leg. Come into it again. Out here. Now chest up, chest up. And I'll do it in all directions for those multi-directional instability patients, especially your girls softball, volleyball players. Put them in a position where they're going to be at in volleyball. I'll put them here and I'll have them right there and I'll do it here. Same way I'm doing it with Austin. I'm thinking about where he's at in the throw. Hold right there, and then I'm taking him in all directions. Specifically where I find that he's weak. So if I find that he's having weakness of infra-teres or external rotators up here, I'm going to focus more pressure that way, and he won't know when it's coming. If it's something with subscap, I could take him farther out in front, give him some of these. I could vary him into a little internal rotation. Come on, don't let me move you. Tricep, bicep. I'm always thinking about where they're at in the throw. I love the ones where they're in a dynamic stance, working on trunk control, work on hamstring flexibility, glute, quad strength by putting them in that lunge simultaneously with my perturbation. I'm not just doing it straight out here in 90 degrees of flexion. Now, maybe I need to start there because maybe I have a really unstable shoulder and this is just, I start out here in the scapular plane or something like that. But I'm always thinking, how is this going to transfer to sport? And far too often in rehabilitation and sports performance, our exercises never transfer to the sport. To transfer to the sport, they need to be specific. Perturbation exercises are only specific to a certain level when they're performed in manual perturbations like this. We need to maximize the positional specificity to allow them to transfer, because the contraction sequence and specificity, those things are, and the contraction type specificity, those things are not going to occur in our manual perturbations. If you liked how we did manual perturbation exercise here, give us a thumbs up, subscribe to our channel so you don't miss any of our future content. But like I said, guys, if we're gonna apply these exercises, you got an athlete, it's not enough to just have them on the table and just pushing their arm in all different ways. Yes, it's difficult, but it's not gonna help them in their sport. Make sure your manual perturbations are specific, put them in the position they're going to be at during the throw or during their sport, and then have them contract in ways that are as close as possible with joint angles as specific as possible to what occurs in the sport, and then vary it so that they have stability through all of that range. Don't just put them in one place or two places and expect them to be stable throughout the range. I don't care if a thrower can contract the rotator cuff really well right here, because it never happens during the throw. Yes, I would like it to happen, but I need them to contract the rotator cuff really well through the entire range of the throwing motion. So that's where I apply my perturbations. Like I said, guys, subscribe to the channel and we'll be at this again next week with another video. Can't wait to see you guys there.